Okay, in this section we're going to look at different articles. I do want you to know and understand the gist of these. First one we'll look at is the percent load that the low back experiences in different positions. So this study was done on a 70 kilogram person. So if you weigh more, the percent disc pressure on the low back will be more. If you weigh less, the pressure will be less. Okay, the least invasive is when you're laying down. So in this position, the low back is experiencing a 40% increased load. Standing with good posture, which most of us don't, but with standing with good posture, 100% disc pressure increase. Sitting with good posture, 140, and most do not do this, but if you did, 140. Standing with poor posture, 150. Sitting with poor posture, and most of us are here, so the low back is experiencing 185% increased disc pressure. That is substantial. That's quite a bit, and one of the reasons why there's so much low back pain and issues in our culture, because a lot of us just do a lot of sitting throughout the week, and we don't really counteract that with exercise, core strengthening, and so forth. Okay, lifting a 20 kilogram weight with good posture puts a 300% increase load on the low back, and lifting with poor posture, just with a 20 kilogram weight, so if it was more, this load would be more, but in this one you're seeing 485% increase pressure. And you know, people wonder why their low back gets blown out when they lift something up, and it doesn't take much. And the weaker your core, the more sedentary you are, the more susceptible your low back is to injury, even with basic movements, just leaning over to pick something up. So I would encourage you to do the best you can to be mindful to not sit for more than 40 minutes without getting up and walking around, doing a few minutes of stretching and just something, you know, versus just doing an 8-hour day, not getting up, not doing anything. I mean, I hear these stories all the time from people with the sedentary life because of work and just sitting at home and really doing nothing. Okay, in these articles, I do want to talk to you about what happens with misalignments. Okay, what happens with these subluxations. So we're going to take that article we looked at first week of class, spine journal, that talked about when your spine is misaligned and goes out of place, you have aberrant health, abnormal health, scores get worse, health scores get worse, pain increases, dysfunction increases, that kind of thing. Okay, so we're going to look at some of that stuff here. Now you're going to want to take notes. Okay, pause this at times because I'm going to introduce some new terms to you. Okay, this one up here. It is well established that nociceptive and other aberrant neurological input from dysfunctional musculoskeletal structures of any component of the human frame influences the autonomic nervous system. Okay, so some new terms here. This one here, nociceptive. That's our pain fibers. Aberrant neurological input means as information is going from your body to brain, if this is occurring on a dysfunctional musculoskeletal structure, okay, so your joints, let's just take the low back for example, the bones are misaligned, you're irritating pain nerves, and you're causing aberrant neurological input to the brain. Okay, this will affect the autonomic nervous system. Okay, now another new term for you. The autonomic nervous system is the nervous system that controls the things in our body on its own, like your heartbeat, breathing, pupil dilation, the way blood vessels dilate and constrict, and digestion. Okay, all those things you don't consciously control. Your body just does it for you. Okay, it's autonomic. Long-term activation of spinal and extraspinal nociceptive afferents. Okay, new term there. Afferent is body to brain. The way our nervous system works, the brain communicates to the body, and then the body communicates to the brain. That is called afferent. Afferent is where the information goes from body to the brain. That is afferent. So long-term activation of spinal and extraspinal pain afferent contributes to stimulation of the autonomic nervous system that may in turn have a deleterious effect over time on visceral function. So this can hurt your viscera, your organs. So digestion can decrease in function. Your heart can decrease in function. Breathing can decrease in function. Immune system can decrease in function. This does hurt you over time. Now, one of the things that I practice in functional medicine is immune boosting techniques. In ANP2, we dive really deep into our immune system, fascinating how our bodies work with immunity. However, a lot of people wake up and literally practice immune inhibiting techniques, but they don't know it, okay? But they do. From the excessive sugar that they consume, being in stress mode all the time, your spine and joints are out of place, messing with your nervous systems. Diet is very poor. Smoking, drinking excessively, that kind of thing. All these things add up over time and decrease your immune system. So when I sit down and visit with these people, we hit a reset button. We start over, rebuild the immune system. Part of that protocol is realigning the spine, getting the nervous system healthy again, changing some diet and lifestyle things, immunoglobulin therapy, and some other really neat immune boosting techniques. Okay, so visceral function and homeostasis with the potential to negatively impact health and wellness. So that article we looked at first week out of Spine Journal and this one starting to tie together. And what I really want you to own here is the reason why is because you're messing with your nervous system. The more unhealthy your nervous system, the more aberrant the joint dysfunction, especially within the spine, the worse you're going to be over time, because you're inhibiting your nervous system from functioning optimally, so function goes down. Okay, down here, the study shows acute musculoskeletal injury affects the activity of the cutaneous and vasomotor sympathetic neurons, altering peripheral and cardiovascular autonomic modulation. Translation: when you hurt the muscle skeletal system, you're going to mess with the activity of cutaneous and vasomotor sympathetic neurons, so your stress autonomic sympathetic nervous system, which alters the peripheral and cardiovascular autonomic modulation. So heart starts to experience dysfunction. And the solution to fix that, on paper, very simple. Change diet and lifestyle, reduce stress, realign the spine, wake up the nervous system, things get better. Okay, now the medical model, they'll throw beta blockers at you, anxiety medication, and on the list goes. Muscle relaxers, which is a CoQ10 inhibitor, which can create muscle problems later down the road. So unless it's life-threatening, it really is ideal to try natural things first. Easy things, at least on paper, it's easy. Change your diet, change your lifestyle, get your spine, get your body healthy, get the core strong, get up and move. lots of good changes happen just by doing those things. Okay, on this one I want to briefly talk about surgeries. Okay, the ratio of back surgery. In the U.S., and we just blow it out of the water. There's so many back surgeries. Most of them are unnecessary. Okay, and in these articles, especially by Richard Deo, really like his work because he goes in and studies, is spine surgery really working? Okay, so they look at it and they talk about it. So in this one, the bed rest is now considered an anathema. Resuming normal activity as much as possible may be the best option for patients with acute back pain. Okay, so this is something I've been saying since day one. You've got to move. The human body is not designed to be static. It has to be dynamic. The more you move, the better things get. Okay, so these treatment plans where they say, immobilize the joint, put your whatever in a sling, in a cast, in a boot, the cervical collar, and on it goes. I mean, yes, I get it. There's a time and a place for that. Sometimes you need to immobilize joints so they can heal, but the sooner they can get moving, the better. Okay, so I would encourage you. And now listen, please listen carefully. This is no knock on surgeons. They are really, really good at surgery. They really are. But after that, it's really not their place. Meaning PT and rehab and that kind of thing. It's not their thing. So it is important, very important, that you for yourself, if this ever happens to you or for your patients, after an injury or a surgery or whatever, you've got to get them moving as soon as possible. Okay, in this one, recent studies show that even for patients with a herniated disc, spontaneous recovery is the rule. So they don't need surgery. You don't have to jump directly to surgery with a herniation. Studies using repeated MRI reveal that the herniated part of the disc often shrinks naturally over time, and about 90% of patients will experience gradual improvement over a period of 6 weeks. Thus, only about 10% of patients with a symptomatic disc herniation would appear to require surgery, and because most back pain is not caused by the herniated disc, the actual proportion of all back pain patients who are surgical candidates, only about 2% really needed it. Insane. Our culture does not follow this protocol. I mean, if you come in with a herniation, they just want to cut on you. It is best to just give it some time. Now, granted, you will get better quicker with conservative management, like spinal decompression, some core strengthening rehab, electric stem, dry needling, all those amazing techniques that can be done, adjustments and so on. That'll get you over the hump quicker, but just leaving it alone, it can heal. Okay, so do the best you can to not go under the knife right away. Recommend this to your friends and family, that if they pull the S card, surgery, that just to get a second or third opinion. Maybe you don't need it. In my practice, deal with a lot of herniations. They're common in your neck and in your low back. And people come in for second opinion. We look at the MRIs together. We look at the x-rays together. We do orthopedic tests, put them through all these functional tests. And they qualify for conservative management. And then they like that idea. Like, let's do this instead of surgery. And lo and behold, they get better. Get better quickly. And they're happy. Okay, so down here's your author, Richard Deo. Okay, Newsweek even did an article a while back on back pain. And, it affects a lot of people. In this article, 65 million Americans. And I pulled some of the pages out of that periodical. Now, Newsweek is not a medical journal, but they do have some good points that they made in here. Here they show the public different problems that can happen with your back. Okay, you can get a so-called slip disc degeneration. That's your spondylolisthesis. And then here's osteoarthritis and disc degeneration. Over here they're showing the herniation messing with nerve root. Okay, now tracking the cost, at least in 2004, more than 65 million Americans suffer from low back pain, directing costs of treatment to run over $100 billion. Okay, patients with back pain spend about 60% or more on annual healthcare costs than patients without back pain. Then you have lost time from work,